right team. We have a patient presenting with sesamoiditis, intertrigo, and primary sclerosing cholangitis. What's our diagnosis?
Those symptoms could indicate a number of things. It could be something related to the liver, maybe an infection or inflammation.
Or it could be a skin condition given the presence of intertrigo.
But sesamoiditis suggests a bone problem. It could be related to the feet or toes.
Seaver-Cassidy syndrome. That's the diagnosis. And the treatment, rhinectomy.
Rhinectomy? Are you sure, Hawks? That's a risky procedure. It could endanger the patient's life.
I don't give a damn about the risks, Gary. It's the only way to save this patient. We have to do it.
But what if there are complications? What if we're wrong about the diagnosis?
Ox, are you absolutely certain about this? We can't proceed lightly with a rhinectomy?
I'm the damn doctor here, and I know what's best for my patients. Get ready for surgery. We're saving a life today. Tracy, I believe performing a rhinectomy is the best course of action for my patient with Seaver-Cassidy syndrome.
Hawks, that's a drastic procedure. Are you sure it's necessary?
I have years of experience, Tracy. Don't question my judgment.
I understand, Hawks, but we need to consider all options before going ahead with something so extreme.
I know what I'm doing. Trust me, this is the right decision for the patient.
Hawks, I respect your experience that we need to discuss this further before taking such a risky step.
Oh no, this is not good. The patient is in critical condition. How am I going to tell Hawks that the rhinectomy was not the right treatment for Seaver-Cassidy syndrome? This was a huge mistake.
What the hell were you thinking? You nearly killed the patient with your incompetence.
But Dr. Hawks, we followed the protocol for rhinectomy as per the guidelines.
Protocol guidelines.
Actually, I think the patient might have been suffering from a severe case of ozena, leading to the wrong diagnosis.
Oh, look who's suddenly a genius after almost causing a fatality. Ozena, my foot! You're as clueless as the rest of them.
I still stand by my initial diagnosis of rhinitis. It presented with all the classic symptoms, I swear.
Classic symptoms. Classic incompetence, more like it. I can't believe I have to work with a bunch of amateurs like you.
I'm out of here before you cause any more harm.
Storms out of the room. I just can't seem to crack what's wrong with this patient. It's driving me crazy.
Maybe you missed something in the lab results? Or did you consider that rare genetic disorder?
I've checked everything, trust me. It's like a medical mystery I can't solve.
What about the environmental factors? Have you looked into that angle?
I did, but nothing seems to fit. Wait a minute.
I think I got it. It's a severe allergic reaction to peanuts.
Seriously, how did you figure that out just like that?
Years of experience, my friend. Gotta go. Duty calls. See you later?
Wait, where are you going? Hey, at least say goodbye.
I know this looks unorthodox, but trust me on this one. We need to act fast.
Hawks, you can't just barge into the ER like this. Wear your gloves and gown.
This is highly irregular, Hawks. We can't proceed without following proper protocol.
I can't believe this. What are you even thinking, Hawks?
Listen, Seaver-Cassidy syndrome is not what we're dealing with here. It's multicentric carpotersale osteolysis syndrome, and we need to address it now. Tracy, I finally found the right diagnosis for the patient.
Congratulations, Hawks. But let's not forget that the wrong diagnosis almost cost them their life.
If you had just listened to me from the start, we wouldn't have been in this mess.
Excuse me, you're the one who ignored the crucial symptoms and went on a wild goose chase.
Wild goose chase. I was following my instincts, Tracy.
Instincts? More like reckless arrogance.
I can't work like this, Tracy. I know what I'm doing.
And I know what's best for the patients. We need to trust each other, Hawks.